First, let me preface it by saying I'm not a fan of Obamacare, right? Obamacare is a federal mandate. I don't agree with the federal government imposing their will on people, telling them what they need to buy. It's been a system that has driven up costs for people. It was a promise that would reduce them. It would tell you could keep your doctor. They can't keep their physicians. So it hasn't been a system that's worked well. Nonetheless, with that in mind, the governor decided to expand that out through his own, kind of executive order, and basically got that out for the rest of the state to happen, have expanded Medicaid now, and didn't bother going through the legislature. So with all of that, I wasn't in favor of how it was rolled out or the idea. But with that said, I do serve on appropriations and revenue, and so the big concept that we have right now is we have a big bill coming by 2021 of about $363 million annually to cover the cost of expanded Medicaid. The governor is going to be gone, his cabinet will be gone when this bill comes due, and we've got to find a way to pay for that. The concept is, if we got something like Connect, which is a good state exchange, at least it's a good website to help people channel and try to buy insurance, and other states are looking for a very similar model, why not use this model and basically outsource it for other states or run the exchange for them? We know there are certain states that would like to have one done that haven't been able to do one, like Oregon, Nevada, Rhode Island. Maybe go to them first, ask if they're interested, and if they are, we can consider buying the hardware, hiring the engineers, and running an exchange for them in exchange for revenue. We can then take that money in, and if we got enough states paying us $25, $30 million apiece, you could cover the cost for the $363 million by 2021, effectively using the tax dollars from other states to help avoid tax increases for people here back at home.
Now, what are we looking at having come due in 2017? What's the number that we're looking at?
Yeah, so it's $74 million. I think 2018 will be 176, and it keeps ramping up. It'll be about $1 billion collectively between 2017 and 2021 when you add it all up. But it starts off with 2%, and then it starts to ramp up to a full 10% of the cost, which will be $363 million by 2021.
How much do you think we could get from each state? So let's say we had one state starting out. How much could we get from them?
It's unknown. I have no idea. So again, it's just a concept. There's not really a plan behind this. I'll be talking to some people up at CMS to gauge an idea of what they would be willing to pay for that, to see if it's even feasible. I mean, a lot of these states are resorting to the federal exchange, and if they're using the federal exchange for their Medicaid expansion, I'm not even sure how much they're paying them. I know it's a percentage of their expansion members, but that might be just maybe $5 million, and if it is, then it may not be worth our while to try to do this. But if they're paying the federal exchange, 30, 40, 50 million, and we could do it for the same cost, then it might be something they might consider. But I really have no idea right now how much they're paying or what they would be willing to pay for us.
Now, would this take legislation to put through?
Well, I think it might. I mean, the governor's done a lot of these things through executive order, but if you're going to start spending money to invest in programs that you're then going to outsource to other states, I would rather see everything go through the legislature. I think the expansion of Medicaid should have gone through the legislature. So clearly, anything that's going to require tax money being spent should go through the elected leaders of the people. So yes, I would think that something like this, the governor might be able to negotiate the deals with other states, but if we're going to put out money to help get this rolling, it should go through the legislature.
So is that something you're trying to get done in the next session?
Well, I'm trying to look at see if there's enough interest. So I don't have enough information to propose a bill. That's why I reached out to the cabinet to ask that they might reach out to those states and kind of have those higher level discussions. If there's interest, then I think it would be worthwhile to come back and start considering that to help us generate some revenue.
Now, who all have you talked to about this idea on each side?
Yeah, so I've talked to leadership in the Senate, obviously. I've talked to Democrats in the Senate as well. I've talked to House Republicans and House Democrats. I've also spoken to Larry Bond, the Chief of Staff of the Governor, and the Governor himself. And I've spoken to Audrey Haynes about it as well. And everybody seems to like the idea and the concept. Again, there's still just a lot of unknown information. I've also mentioned this concept at my Budget Review Subcommittee, in which members of the cabinet were there and said, it's plausible. So the question now is you just don't have enough information really to make a concise decision and an informed decision as to whether or not there's even something we can do. But it's just an idea that we can move forward with.
So what all would this take in terms of extra manpower, software? You mentioned software. What all would this take from the state? Well,
we already own, I asked that in committee, and the cabinet has said we already own the software. We own the hardware for our own exchange. We own all the intellectual property. So it's the state's property. We can use basically software and the same people who developed this to put another one together, let's say for the state of Oregon, for example. What you would need is an engineer probably to help devote their time to it and run it and maintain it. But that expense, I would think, after all the already upfront costs have been spent to develop the software and the intellectual property, those could be saved because you've already done that. All you got to do is basically get another computer tower and put that information in there and be able to correlate that information with Oregon. And we probably could get that done for them. So That's the thought, is I don't think it would be as expensive to run there since we've already done it for ourselves. But as far as, manpower, would be engineers to run it. If you got enough states doing it, and it's something that we could consider doing, you might actually get enough of a hub of people that we might become the state exchange kind of location for the country to be able to run other state exchanges.
So it would be housed in Kentucky and not in these other states?
That'd be the idea. But like I said, it's still just a concept. It's not even a plan necessarily, but that's the idea, that I thought would be kind of something worth exploring.
So, and the whole reason you came up with this idea is because either we find a way to make money or we're going to have to pull it from other places, right?
Exactly. So we've got the budget is not, the cabinet has assured us that cost is going to be covered by expanded jobs, and there's no guarantee of expanded jobs. I mean, that's kind of a silly way of looking forward. And again, they'll be long gone when this expense is going to be due for the taxpayers of the state. We've got to find another way to help cover those costs. Either we have to rob it from other departments, for the Department of Education, and take it from the schools and put it into healthcare, or from some of the other smaller, components of the budget, which is things like, fire and police, and those guys are already strapped very, very thin. So it's a huge amount of money. We're going to have to find a way to cover that. If we don't, we're going to be stuck. Either have to roll back the expansion or do something else. That's why I'm trying to find an innovative way to help cover that. And if we've got a commodity that we've got, whether we like it or not, it's there. If we can use that and other states want it, why not take advantage and let those states pay for our Medicaid expansion?
Now, in the meeting that this idea first came up, I think that you mentioned the 3.5% is the federal currently, correct? And we're paying 1% on our plans.
Yeah, so it's 1% for all members, but the 3.5% is only for expansion members. So that's a clear distinction to make, that it isn't 3.5% for everybody. It's 3.5% just for the expansion folks. Traditional Medicaid are not included in that. So the number, again, I don't know what that number officially is. I would think it would be easy to calculate. For whatever reason, our cabinet hasn't been able to do that. But it is 3.5% of the expansion, while the other 1% is for everybody. So that's the difference in those numbers.
If someone were to come in office next year and completely repeal Connect, get rid of Connect, what would happen then? I mean, are we going to be able to continue on this type of path, or what would happen in that situation?
Yeah, so if we repealed Connect, we go to the federal exchange. We know just from that committee hearing it would cost about $23 million to decommission the state exchange. But what would the federal cost be? I don't know. I've asked for those numbers from the cabinet, and they can't seem to produce them, which is very frustrating. That would be the number to know what it would cost. It might be a savings from that per year. There is some data collection that the state exchange does provide us that we can offer that will help us in terms of monitoring patients and that sort of thing. But for right now, it would just be the savings of running that every year, or it would be an increased expense, but I don't have enough information to even know that number.
But with this Medicaid expansion and so on and so forth, would it really hurt the state to repeal it? Obviously, you're trying to find a way to keep this going because it's clearly working. I mean, do you think that it would be a detriment to the state? I don't
know. I don't know. I know what the benefits that the state exchange can provide. What I would like to see is the federal government truly repeal Obamacare and go with a private model. I'd like to see them impose tax credits for people that want to buy their own insurance plans, so that if someone who's 27 years old doesn't need to be buying nursing home coverage, you don't have to have somebody who's 80 years old buying pediatric coverage. Right now, the government has a one-size-fits-all policy, which doesn't make any sense for what we need. Let people buy the insurance plans that they want. I'd like to see the federal government just get rid of Obamacare, keep some of the ideas that we like within it, but get rid of it, let people buy their own insurance plans, reduce competition across state lines, and let people be able to shop for insurance anywhere in the country. We could use the exchange for other purposes than just as a way of buying people within the ACA or buying an insurance plan. It is a data collection kind of website, so it's got a lot of other uses that we could use for that, and what those could be, I don't know. But if we got rid of the state exchange, we could still keep it for other purposes. It just wouldn't necessarily be for that, and we could use the federal exchange to run our numbers through that. But I don't know that it needs to stay. I mean, I'd like to see the federal government come in and just get rid of it, keep their promise to get rid of Obamacare altogether, and let people make their own decisions on their own health care. I mean, right now, the way it's working is the expenses for patients on a day-to-day basis is way too high. Their co-pays are too high. A lot of people have gone from uninsured to being underinsured. They still have such high deductibles that they don't get their health care anyway. So it's kind of been defeated the purpose. It really hasn't worked well. But if we're stuck with an expanded Medicaid system and we've got an expense, we've got to find a way to pay for that. So the options are either for the next governor to say we're going to roll back all of the expanded Medicaid, which is one option, and get rid of it, or keep it and go with the federal exchange. And there's different scenarios that could come forward, and that's going to be for the next governor to determine.
Now, is there anything else about your idea about how to pay for it that we haven't covered that you want people to know?
Yeah, just, I mean, and again, it's a lot of folks are under the impression that I'm trying to keep it alive, and that's not necessarily the case. I'm looking at it from an expense perspective. We've got to find a way to pay for it. This is an option to consider paying for it. That if we don't, then we're going to be stuck pulling that money from somewhere else. So I'd rather see the federal government keep their promise to defund it, get rid of it, go with a private model, something that's going to work for the private sector. And I think we get better solutions when we let the private sector solve these problems than having government come in and provide one of the biggest tax expansions we've ever seen in this country, and effectively not solve any of the problems they promised. And that's the issue at hand. Is I think the private sector does it better than government can.